Good evening. My name is Russ White, and I work at a place called Tenwek Hospital in Kenya, East Africa. And I've been privileged to be there for about 20 years now. I started like that. That was in the Belgian Congo. I'm the little one up in the top, where my parents were medical missionaries. We came back to the States when I was pretty young and grew up most of my life here in the United States, but I spent those first days of mine on various people's backs and carried around while my mother and father did a lot of medical work and teaching and training, and never really knew where that might go in life, but felt like God would lead us. That took my wife and I back in 1992, back when I had hair. I told Paul Osteen, this is a choice, by the way. I don't have to do this. I choose to keep it short. But we took our 12-month-old to Kenya, not knowing for sure what God was going to lead us to do or call us to do. And God led us to return, and we've been there for a little over 20 years now. We've gotten a little bit older since that time, as you might imagine. And we've changed a little. My wife hasn't changed much at all. Paul and Jennifer will tell you she looks the same as she did before. People don't tell me that very often. But our family has changed. We have 5 kids. We've added a daughter-in-law to that whole mix, which has been just wonderful. My youngest son, who wasn't in the last picture, is getting ready to graduate from high school and return here to the U.S. Sometime. But I want to ask you a few questions tonight. I want you to think about it. What are you here for? I call this Motivations in Medical Missions, and I didn't realize till I got here yesterday. I said, oh, that's M3, right? That's Motivations in Medical Missions, and I didn't even think about that, but that's the title I had put on there. It's not exactly what Paul Osteen had put on, but it was what I was thinking about. What motivates us to do what we do? What are you here for? What are you here for? You know, Newton's first law of motion, which some of you may remember, I really didn't. I remembered the illiterate's version of that. But every object in a uniform state of motion tends to stay in that state of motion unless an external force is applied to it. So we all know that, right? We know, I learned it as a body in motion stays in motion. I used to have this great idea when I was a kid that if I was ever in a plane crash, I would be okay, because when it was going down, I'd get out on the wing, and then right before it hit the ground, I'd just step off onto the ground. And I'd be all right. It would only be a few feet to step. I didn't realize quite then that a body in motion tends to stay in motion, like this truck driver didn't remember before he hit the brakes. But the converse of that is true also. A body at rest tends to stay at rest. And I am convinced that for a majority of people, at least a large proportion of people in this world, the major motivating factor in what they do is inertia. A body at rest tends to stay at rest unless some external force is applied to it. And some of us need more pushing than others, and some of us have more mass to get moving and overcome the laws of inertia. What are you here for? Why am I there? Why am I in Africa at Tenwek Hospital? What makes me stay there? There's a lot of answers to that. This is Tenwek in recent years from the air. It's grown quite a bit over the years. This is a younger, brighter, fresher version. Dr. Paul Osteen, I think that may have been his first arrow extraction of many to follow at Tenwek. But Tenwek has really grown a lot since that time. We have a pretty simple mission statement. We're committed to compassionate medical care. We're committed to spiritual ministry, and we're committed to teaching and training for future service. We try to keep all those things in our focus as we move ahead in life. Our current hospital, we see about 150,000 patients a year. We're admitting about 15,000, doing about 8,000 operations per year. See a lot of HIV patients, a lot of babies born. We're training medical students, family practice doctors, general surgeons, orthopedic surgeons. We're looking at starting an OBGYN residency, an ophthalmology residency, and a cardiothoracic residency, which I'm personally very involved in. We've done some kind of pioneering things in cardiothoracic areas where I really didn't see that we could move that way, but God pushed me in different directions, and we're now doing about 2/3 of all cardiac surgery in the entire sub-Saharan region of that. Now, you in Houston would know that Houston is a pioneering city of cardiovascular work as well. In many ways, thanks to Dr. Denton Cooley, who was from Houston until last year. Dr. Paul and I had the distinct pleasure of meeting him last year after this conference and chatting with him, and came to realize that many of the tools that I was using were tools he had developed here in Houston, and some of the early tools I used were some of the things he had developed back in the 50s and 60s. The first patient, one of the first, that we ever operated on their heart is Daniel, shown here, with Agneta, who is my young compatriot, working with me now. This was in 2008 that we operated. Daniel, we used an old-fashioned tool that Dr. Cooley would have used in the 50s to operate on him. He's from rural western Kenya, way up in the north part. This picture was taken last week at Tenwek. He's doing great. He's a star soccer player after his heart surgery, and it warms my heart to see that. This is Aisha, who I operated on last week. Aisha means life. She has tetralogy of Fallot. You might notice her fingers look a little bit funny. That's called clubbing, as many of you know, and her clubbing was blue all over her. That's changed. The clubbing's still there, but her fingers are pink as opposed to blue, which her tongue and everything else was blue before we operated on her. These are all the kids we operated on just last week with congenital heart defects. They're at Tenwek that Agneta and I worked on together with a gang, a group. And this little child, Agneta operated on yesterday. She sent me this photo this morning. That's another child with tetralogy of Fallot that Agneta repaired this heart defect on this little child. And that child's doing great. Why am I there? I was challenged early in my medical training in medical school, and was given an analogy that really stuck with me. A speaker said, if you come to a group of 10 people holding up a heavy log, and 9 of them are on one end of the log, and 1 of them is on the other end, and you want to help, where are you going to go? It stuck in my head. It made sense. Where are you going to go? I put that together with the facts and figures that go hand in hand with public health and needs around the world. If you look at where there are critical needs, certain areas jump right out at you from the map, sub-Saharan Africa being foremost among them. Africa's a huge place. If you'll remember, you can take the United States and India and Western Europe and China and Argentina. You can put all those countries in and still have a lot of room left over. It's an enormous place. It has about 11% of the world's population. 24% of the global burden of disease on this planet is in sub-Saharan Africa. And less than 1% of the global health expenditure takes place in sub-Saharan Africa. Where is the need? It wasn't that hard for me to think about. It has 3% of the world's healthcare workers taking care of 24% of the planet's healthcare needs. And unfortunately, up to 50% of those trained within those countries will often leave the countries, leave the entire region, and be working somewhere else. If you look at number of doctors per patient, or conversely, number of inhabitants per doctor, doesn't take a rocket scientist to figure out where the need is greatest. Where can you be the most help? For me, it wasn't in northern Michigan where I grew up. It was somewhere else. And I had to listen. Where am I going to go? You know, I never heard God speak directly to me and say, go to Africa. It was just clear to me. If I was going to be involved in taking His ministry of healing and spiritual regeneration and forgiveness and a new life, I need to go where the need is the greatest. I've thought often of this story in 1 Samuel of Jonathan and his armor bearer, and you can read that tonight before you go to bed. The Philistines have dominated the Israelites. There's very little left for them to do, and Jonathan's father, Saul, is hiding. Jonathan sees a situation with the Philistines on the hill, and he says to his armor bearer, let's go up there and fight these guys. There was one guy. There were many, many up there. Nowhere does it say God told him to do it, but he had the tools and the abilities, and he saw a need, and he went. And God delivered the Philistines that day into his hand, and that turned the entire tide of that conflict because of what he did. You know, God's calling doesn't always make sense to us. This is the pediatric ward at Tenwek Hospital, and we see hundreds and hundreds and thousands of kids through there all the time. And let me tell you about Chibet. Chibet was 3 years old. They brought her in. They told me there was a girl who was having trouble breathing in casualty in the emergency department. I went over and looked, and this girl looked terrible. Her mother said she was fine until that morning when she was playing with a bag of beans, red beans, and she had trouble breathing, and I said she's probably aspirated a bean. This was years ago, many years ago. We took her to the operating room, and I told her mother, we're going to try, but I don't really have the tools I need to get this thing out of there. And we took her in the operating room, and I put her on the bed, and her oxygen saturation was very low, her breathing was very rapid, her heart rate very rapid, and I took what was essentially a metal tube, old rusty tube, and put it down her throat and shined a flashlight in the end and couldn't see anything. And as I'm doing this, her heart rate drops and she arrests, and we do CPR and got her going again. And then I tried again, and the same thing happened. And then I tried again, and the same thing happened. And I said, this just isn't going to work at all. I said, look, let me wash my hands and we'll open up her chest and try. But I knew getting to that spot where that bean was stuck was going to take a long time, and there was just no way to get her through. And so I went out and was washing my hands while they cleaned her chest. And in that moment, God did speak to me. Almost audibly. I thought it was audibly because I responded audibly. I said, what do you mean, try again? I said, have you not been paying attention here? This is, we've tried this. We've tried it over and over, and it's really not working. It's not going to work, and she's going to die, and there's nothing I can do to stop that. God said, that's right, you have tried. Now you go back in there, and you do it again, and you let me work through you. I walked back in that room, and I said, we're going to do this again. They had put the scope away. They said, you know, we've already... I said, look, I've had an argument already with somebody higher up the food chain than you are, who says we're going to do it again, so let's try it again. And as I walked in, there was a tool sitting on the counter. I don't know why it was there. I would have been the only one to use it, and I hadn't used it. It was a ureteral stone basket you used to get kidney stones out. The route you take to get a kidney stone out is slightly different than the route you would take to get this thing out. But I put this scope in, the heart rate started to drop, everything looked terrible. I put this basket in blindly and closed it, pulled it out, and there's a red bean in the basket. This girl's heart rate started to pick up and her oxygen picked up, and within about 10 minutes she's sitting up looking at us, wondering what we're all doing in this room. And one of our technicians put it well. He said, "I'm so grateful God allowed us to be here when he did this." God's calling doesn't always make sense to us. What is God calling you to? What are you here for, as I conclude? What are you here for? Now, I promised Dr. Paul Osteen that I would keep things unpolitical, so I hope I'm not breaking that rule. I don't know if there's any Buckeyes out there, but I'm a Wolverine. I'm from Michigan. There you go. Now, when I see these slogans, like I hate Michigan, or I don't hate often, but when I do, I think, isn't that sad that you're known by who you hate? Isn't that a sad state of affairs? Or you can be a little kinder, make it a little more gentle on how you say it. Or, for those mothers in the audience, if you're going to be a good Buckeye, you got to teach them young to, you've got to really indoctrinate. Isn't that a shame to be known for what you hate? And now, then it can go to the extreme, where you just get bad taste, of course, in your hatred. We've even brought it into medicine to some degree. Primum non nocere. It's Latin. You probably know it as first of all, or above all, do no harm. And we've somehow come to think that that is the prime directive, like Star Trek or something, in medicine. If I ask you who said that, people would say, it's Hippocratic Oath, right? Well, it's not. It's Latin. Hippocrates was Greek. He didn't speak Latin. It was first attributed to Dr. Thomas Sydenham, who did a lot of work in rheumatic heart disease, or acute rheumatic fever, way back in the 1600s. But he was talking about new drugs for the treatment of gout. And he said, when you're trying these new drugs, remember not to do harm. We've somehow adopted this and say, first of all, we do no harm. First of all, above all, don't? You got to be kidding me. Seriously? I don't want to be known for the things I'm against in life. We do this in the church, in missions. We do it all the time. The people in my group don't do this and this and this and this and this and this. And, I have some views about a lot of those things. I do. But I don't want to be known for the things I'm against. I'd like to be known, and I think God wants us to be known for the things we are for. And what should we be for? It's not that hard if you look through Scripture. What does the Lord require of you? To do justice, to love kindness and mercy, and to walk humbly with your God. So what are you here for? What am I there for? Well, I'm there for people like Silas, who's one of our brand new residents, started last month. He'll be starting on a 5-year program in orthopedic surgery. And I'm there for Joyce, who just started. And I'm there for Samuel, who's one of our new residents, started last month. I just saw his mother-in-law with esophageal cancer. I need to operate on her as soon as I get back. And I'm there for Nerea, who just joined us. And I'm there for Kimutai. And I'm there for Sinket of the Maasai tribe. And I'm there for Patricia of the Marquette tribe, and Ian of the Luo tribe, and Justice, who's in the Luo tribe, and Yvonne Wairimu, who's one of my great residents in the Kikuyu tribe. And I'm there for Victor in orthopedics, and I'm there for Fasto from South Sudan, who's in the Dinka tribe. And I'm there because Valentine needs somebody to teach her from the Kipsigis tribe, and I'm there for Marco Lowe, who's of the Luo tribe. I'm there for John Kanye, who graduated this year in December, and I'm there for Mike, who graduated in December, and Liz, his wife, who also graduated. And I'm there for Ivan Seno, and I'm there for Damaris and Philip, who are both working at mission hospitals, and Elijah, who's at Chagoria Mission Hospital, and Jack, who's in Kisumu working now. I'm there for all of these guys. I'm there for Arga, who finished 4 years ago, who's coming back after he finishes a cardiothoracic residency to join us on faculty, and Agneta, our first graduate, who's also coming back to join us on faculty in cardiac surgery. These 4 graduated, and we committed them to the Lord in December of this year. What am I there for? That's what I'm there for. I'm there for them. What are you here for? What are you here for? What is God calling you to? And would you say yes? God bless you.
A lot of humor in that presentation and a lot of fun with football and team analogies. I appreciate that, Dr. White. He joins us live now for a little Q&A session. If you want to ask Dr. White a question, our Q&A section is open. Just click the tab. You can ask the question. We'll do our best to get those on for you. But Dr. White, welcome. It's good to have you back at M3.
Thank you. It's a pleasure to be with you.
Russ, it's good to see you.
Paul, Jen, it's been quite a while.
Yeah.
You're looking very good. Thank you for inviting me. It's a pleasure to be with you.
You know, Russ, I loved your talk, but I wanted to spend a little time talking about something that's really exciting. You know, I was there when you first started the FACS program, and now I think you said you've graduated close to maybe 26 graduates, but I'm really excited about a recent graduate that you have, the first one of, I think, of the FACS program, and certainly you're someone you're very proud of. And can you tell us a little bit about Dr. Fekadu and what he's involved with?
Sure. Arga is our first graduate in cardiothoracic surgery. We started the program 3 years ago. I think I mentioned in that talk 3 years ago we were just starting. Arga did his general surgery residency with us and then went off for 4 years to Malawi and started a new PACS program down there, training general surgeons. But his heart was always in cardiothoracic surgery. And he came back and is our first fellow. He just graduated in December. He underwent an 11-hour final board exam, the first ever done with the College of Surgeons of East, Central, and Southern Africa. And he's now joined me on faculty. And I tell you, it is an absolute blessing, a tremendous blessing in so many ways. I've been on call night and day for the last 12 years in cardiac, and it's been a joy to have a partner on call. But even more than that, he's just such a gem of a guy. He wants to serve the Lord. He's teaching our younger fellows and residents, and I am thrilled and thankful to the Lord for his presence.
And we know Dr. Fekadu, and he's just a fine, upstanding young man and an excellent surgeon. So congratulations to Arega. You know, Russ, you talked a little bit about this in your talk, but just contextualize the burden of heart disease right now, especially operative surgical heart disease in sub-Saharan Africa.
That's a great question. When I first came to Tenwek, I listened to the last session Q&A you had, and I think Jen was talking a little bit about God's plans and our plans, and heart surgery was never part of my plan for Africa. I did training in it, but I thought I would never use it because I thought it wasn't that common of a condition. It's a Western disease. It's not something we need to worry about. Little did I know of the thousands and hundreds of thousands of people suffering primarily from rheumatic heart disease and congenital heart disease. So to put this in some context, if you take rheumatic heart disease alone, there are about 35 million people in the world with rheumatic heart disease. The vast majority of those are in sub-Saharan Africa. That is essentially equivalent to the number of people living with HIV/AIDS in the world today. But consider, when was the last time you saw a commercial? When did you see a fundraising event? When did you see a promotion looking at research into rheumatic heart disease? It's really an orphan condition because it's a disease generally of the lower socioeconomic classes, and it's just very people are missing the care they need. So I have currently 400 patients on our waiting list for heart surgery. This is life-saving surgery, can give them a normal lifespan, and every week I have 1 or 2 die on the waiting list. There are thousands and thousands of people out there waiting for surgery and waiting to be found and treated. And this is, again, it was never my plan. It's something God brought upon me step by step, and now I really believe we can make a major dent in this condition. And what a better way to change the hearts of the world than to literally and spiritually reach into people's hearts.
You know, Russ, this was made very vividly clear to me when I was there several years ago when Agneta was screening people for the heart team that was coming when you guys were going to operate. And there were 5 little benches out front with 6 children on each one of them. And I remember, and they cry when I tell you, their little feet couldn't even reach the ground. Their hands were clubbed. And what was so sad is that Agneta said, out of these 30 children, we can choose 6 to operate on.
Yeah.
That's the reality of heart disease, rheumatic heart disease and congenital heart disease in Africa. But you know, Russ, you didn't just sit idly beside you. You've got a great vision. Tell us a little bit about the vision for the Cardiothoracic Center there at Tenwek.
Sure, we are limited by many things. Finances are certainly one of them, but that's never the biggest problem. We're limited by space. We're operating out of 1 operating room right now because of all the other specialties that need to keep working at Tenwek. So we have this list of, well, it's 400 rheumatics and about 250 congenital heart patients, most of whom will die. And we are limited by our recovery room space, our operating room space, and our human resources. So we started a very ambitious program 2 years ago to build a new cardiothoracic center at Tenwek Hospital, which will have about 170 beds with 6 operating rooms and 36 ICU beds. And I firmly believe this will be the premier cardiothoracic center in sub-Saharan Africa. And I don't say that out of pride at all. I'm amazed that God is doing this. I say it out of joy that the premier cardiac center in the region, in all of sub-Saharan Africa, can be a center that is giving glory to God and bringing healing to people's bodies. So we're underway. We've completed the apartments for the fellows, and they've gladly moved in. We're getting started now on the main hospital itself, and we're waiting to see what God will do in that.
And it's an ambitious project from a monetary standpoint, isn't it?
It's by far the biggest project we've ever done at Tenwek Hospital. It's the biggest project I've been involved with. And again, it was not something I would have dreamed of years ago, but I really believe it's what God is calling us to do.
Yeah, I think Russ has raised quite a bit of money for it, but I think they need $20 million more. Isn't that correct, Russ?
We need $20 million to bring this hospital up from the ground. The excavation is done. The land was purchased. The excavation is done. We've built ourselves 500,000 cinder blocks to build the hospital. The architects are finished with their work, and yeah, it sounds. I know in the Lord's economy, it's going to be doable. To me, it sounds overwhelming at times. We need $20 million to bring this hospital to fruition.
We're believing with you that God's going to provide for every need you have there. And it's going to be above and beyond anything you could ask, think, or imagine, Russ.
Dr. White, we have some questions from some of our attendees from all over the world today. In fact, our first question is from Shamal, saying, my daughter is a pediatric cardiologist and I'm an internist. Do you have use for those kinds of gifts at Tenwek, should we be able to come?
I would say is the Pope Catholic. Absolutely. In fact, pediatric cardiologists we would blaze the trail for you and welcome you with open arms to come to Tenwek. You can help not only in taking care of patients, but in teaching and training our fellows, in training our residents and medical officers, the whole team of those taking care of these patients. So come on down.
That's not only a yes, that's an emphatic yes,
Yes.
from what I hear. Quick question about that. So should they want to get in touch with you, just to flesh out some of those details, what's the best way to do that?
Most of our visitors come through World Medical Mission, the medical branch of Samaritan's Purse. And World Medical Mission is well familiar with Tenwek Hospital, and they've been working closely with us on this cardiac project. So they would be very happy to put them in touch with the right connections and make the way easy.
Yeah, and Paul, you got some more
Yeah,
information.
and that World Medical Mission website is on our website under the exhibitors booth. And World Medical Mission will just absolutely make it easy for any visitor to come to Tenwek. And as Russ said, that her skill set would be a great fit there.
Yeah, good, and you can find some more information. Our time is running short. Russ, one more quick question. How should a medical student and or doctor overseas prepare for missionary surgery prior to going?
That's a great question. I would say, we could talk medically, and from a medical standpoint, you'd like to get a little broad experience in some areas that you may not get in the U.S. with some orthopedic experience. But I would honestly say prepare your heart and be flexible, and the Lord will use you. Thank you so much.
Hey, Russ, our time's up. But listen, we're praying for you guys every day, and greet Beth for us.
I will do it.
All right, thanks,
I'll
Russ.
do it tonight.
Thank you. Tell
right.
Orego we said hi.
I'll do it tomorrow.
Thank you.